Sup, chooms? How y'all living? Hope everything is Nova and you're all having a preem New Year's. That was refreshing. So anyways, when it comes to discussing androgenetic alopecia, it is impossible to avoid the subject of dihydrotestosterone, also known as DHT. DHT is the androgen which is responsible for the progression of male pattern baldness in men who have the androgenic alopecia gene. So if you have androgenic alopecia and you want to stop hair loss, then you should take something to lower DHT such as Finasteride. In fact, you need to. There is no alternative at the moment. And that sounds pretty simple, right? Well, fortunately, through the use of 5-AR inhibiting drugs like Finasteride, we can safely lower our DHT levels with minimal risk of side effects, and this will stop or reverse hair loss in over 90% of men who use the drug, even when used by itself. However, used in combination with a powerful growth stimulant like topical minoxidil, Finasteride will work even better, even though that is not necessary in 100% of people who have androgenetic alopecia. On the contrary, Finasteride alone usually will suffice. So obviously, we're extremely fortunate to be living in an era where hair loss sufferers have access to legitimate hair loss treatments like Finasteride, as well as other 5-AR inhibiting drugs like dutasteride, because these drugs target hair loss at its very source by targeting DHT. Minoxidil is a great drug that promotes hair growth, but since it doesn't lower DHT, it isn't as good of a long-term treatment compared to Finasteride, and that is why Finasteride should always be your first line of defense in the fight against androgenic alopecia. Chances are that it is all you will ever need to use, but whatever you choose to do, if you want to fight hair loss, then you need to do something about DHT, because DHT is your enemy. Even though there are treatments in development that target some of the downstream effects of DHT, such as the Wnt pathway inhibiting drugs, as well as direct anti-androgens like pyrrolutamide, which recently entered phase 3 clinical trials, for the time being at least, the best way to lower DHT is through the use of a 5-AR inhibiting drug, since it is the 5-AR enzyme which converts testosterone into the trash hormone DHT. And even though DHT does play an important role during the physical maturation of an adolescent male, in adulthood, DHT becomes a completely useless trash hormone that can have a highly negative impact on our quality of life. We already know that DHT does terrible things, such as cause hair loss, as well as enlarge our prostate and give us acne, and I have documented all of this in great detail about why DHT is a trash hormone in several videos, and I'll link those videos below in case you haven't seen them yet. But as it turns out though, DHT isn't just bad because it can turn us into incontinent slapheads with acne. DHT is also bad because it may literally give you heart disease and kill you. You may think it is preposterous that a naturally occurring hormone like DHT could have a causal role in the progression of heart disease, but on the contrary, this is not in the least bit speculative, and there is in fact a lot of high quality research documenting a direct link between DHT and heart disease, as well as research which shows that drugs which lower DHT like Finasteride may even have a cardioprotective effect and extend the life of its users. So, heart disease is obviously a highly multifactorial condition which is caused by factors that are within our control, such as lifestyle, but they are also caused by factors that are not within our control, such as genetics and even sex hormones to an extent. So if we're going to go balls deep and find out exactly why Finasteride can be used to protect against DHT's heart disease promoting properties, we first need to examine the role of sex hormones and how they play an important role in the development of cardiovascular disease. So most people realize that when it comes to heart disease, it is better to be a woman than a man. In fact, being a man itself is a risk factor for developing heart disease, and men with heart disease have worse outcomes than women, at least compared to women before they go through menopause. Because, after menopause, that's when women's estrogen levels go down and the risk of heart disease catches up to men. So what is going on here? Do the higher levels of testosterone in men versus women cause heart disease? Or do the higher levels of estrogen in women versus men protect them from heart disease? Also, does the trash hormone DHT play any role here? As we've discussed many times on this channel, DHT is a metabolite of testosterone and is produced by the 5-alpha reductase enzyme. We already know that during puberty, DHT does play an important role in sexual development. But like I mentioned, after puberty, DHT is just a trash hormone that wreaks havoc on our bodies, causing us to lose our hair and causing our prostates to swell up so we can't pee easily when we get older. But if being a man and having testosterone in your blood causes heart disease, is it testosterone or is it DHT that is causing this increase in the risk of heart disease? And if it turns out that DHT is the thing that causes problems in the heart, could finasteride actually help prevent or treat heart disease? Well, it turns out there is a lot of research on the subject, so buckle up while we go balls deep into the science that shows that DHT is a trash hormone for the cardiovascular system and that finasteride might actually be good for your heart and extend your lifespan. So, if you look at the very first users of finasteride, they were older men who took it for their enlarged prostates because finasteride was first approved for that indication as Proscar at a dose of 5 milligrams per day. It turns out, though, that older men with prostate disease are also men that frequently have heart disease. So they are a good population to look at to see whether finasteride increases or decreases the incidence of heart disease. Since after all, heart disease does take years to develop, even if you're living like absolute shit. This was the patient population that was looked at in a study by Sovereign that was published in the year 2002. And I'll link this and all the studies I mentioned below in case you want to review them yourself. So in this study, the authors looked at men who were on finasteride or another class of drugs used to treat prostate enlargement called alpha blockers. And they looked at these men's hospitalizations for heart problems over a 6-year period and which drugs they were on when they were hospitalized. In this study, the researchers found no increased risk of hospitalization from being on finasteride or alpha blockers versus men not on those drugs, which is shown in this table right here. So this study didn't seem to show any effect, good or bad, on the heart from finasteride use, but this was not a randomized controlled study, but rather instead this was just a database retrospective study. So it looked like from this study that finasteride was safe to use in people with heart disease. Clearly more research was needed. So the next study looking at 5-AR blockers and the role they have on heart disease was published by Andriel in the year 2010, and this was a real randomized controlled study. The study compared the effects of dutasteride at 0.5 milligrams per day versus a placebo in men 50 to 75 years old, with the goal to see if dutasteride prevented the development of prostate cancer. It was a very large study of 6,729 men, and it actually did show a reduced risk of prostate cancer from dutasteride, which is of course great news. But what we are interested in is an unexpected finding that the authors saw during follow-up. The study found a higher incidence of episodes of heart failure in the dutasteride group versus the placebo group, with the incidence being 0.7% in the dutasteride group and 0.4% in the placebo group. The authors had no explanation for this finding, but the results of the study raised the question as to whether blockade of the 5-AR enzyme might actually be harmful to the heart. Well, fortunately, the scientific research didn't stop there, because 3 years later, in 2013, a large meta-analysis was published by Loki, which cleared dutasteride of any cardiac wrongdoing. So for those who don't know, a meta-analysis is a type of study that combines the results of multiple studies to give results that are more statistically sound than the individual studies themselves. So in this meta-analysis, the authors looked at 12 randomized controlled studies of dutasteride involving 18,802 men. In this study, the authors found no evidence of any significant association between dutasteride therapy and the risk of heart failure, heart attacks, or strokes. If you look at this figure from the study, the diamond-shaped object at the bottom is the overall risk of dutasteride versus placebo to cause heart failure, and the diamond straddles with a line marked 1, which means the risk with dutasteride was no different than the risk with placebo. So this is reassuring. But what about the Andriel study we just talked about, which showed an increased risk of heart failure with dutasteride use? Well, it turns out that the FDA had a look at the data from the Andriel study and felt that some of the patients had been misclassified. Quoting the Loki study, quote, subsequent FDA reanalysis of this trial, meaning the Andriel study, resulted in the removal of wrongly coded cardiac failure events such that the estimate of risk was no longer statistically significant. We have used the FDA data in our meta-analysis rather than the original trial results, unquote. Thus, based on this more complete and accurate data, there is no evidence that dutasteride increases cardiac risk, and the first study we looked at from Sovereign didn't show any negative effects on the heart from finasteride either. So 5-AR inhibitors don't cause heart disease. That's the bottom line, and that's good, of course, but so far it doesn't look like 5-AR blockers have any effect on the heart at all, whether it be good or bad. So maybe DHT isn't the culprit here, and we could just move on from the subject, right? Well, not so fast, chooms. There is still a lot to talk about, but first, let's get into some more basic animal research on testosterone and heart disease. We know that testosterone has active metabolites. Some testosterone is converted by aromatase into estrogen, which may have a protective effect on the heart, while some of it is converted into DHT by the 5-AR enzyme. Most testosterone in the body isn't converted to these active metabolites and just circulates as testosterone. So, what effects do these metabolites have on the heart? Well, in a study published by Rubio Gayoso in 2013, the researchers created artificial heart attacks in rats by tying off one of their coronary arteries. They then gave testosterone as well as an aromatase inhibitor and finasteride to see what effects these interventions had on the amount of heart and muscle damage these rats developed. First of all, the researchers found that giving testosterone by itself to these rats before their artificial heart attacks really had no effect on the size of the region of heart muscle damage. But if you give testosterone to rats that had been previously castrated and had no testosterone on their own, then this testosterone was actually beneficial and reduced the heart muscle damage. This is shown in this figure here, where the normal rats are the white bars and the castrated rats are the gray bars, and the control rats who got no testosterone are the bars at the left, and the rats who got increasing doses of testosterone are on the other bars. Giving testosterone to rats lacking testosterone reduced the amount of heart damage, but in the more realistic situation where the rats haven't been castrated, it looks like testosterone didn't affect the amount of heart muscle damage done. However, the investigators wanted to see what effect blocking the aromatase and the 5-AR pathways had on the response to testosterone. So this graph here shows the size of the heart muscle damage from just testosterone infusion on the left versus testosterone plus an aromatase blocker called 4-HA1 in the middle and the 5-AR blocker finasteride on the right. It's clear that if you block aromatase and stop testosterone from converting to estrogen, the heart muscle damage gets worse. But if you give finasteride and lower DHT, the heart muscle damage becomes smaller. To further emphasize that DHT is the culprit here, the researchers again in this figure gave finasteride and decreased the heart muscle damage as seen on the left side. And then they tried giving DHT and showed that DHT increased the amount of heart damage. So these investigators concluded that testosterone itself doesn't have much effect on heart muscle damage during a heart attack, but the DHT created in the heart by the 5-AR enzyme does make heart damage worse, while estrogen has a protective effect. So quite amazingly, it turns out that finasteride, even though it is a drug developed to treat prostate enlargement and hair loss, also had a very significant effect on decreasing heart muscle damage caused by heart attacks. This is particularly impressive because unlike in many animal studies where finasteride is given at much higher doses than used in humans, the finasteride dose in this study was only 0.104 milligrams per kilogram, which in the average 70 kilogram man would be about 7 milligrams. Not that much higher than the normal prescribed dose, and we already know that the difference in DHT suppression between 1 milligram versus 5 milligrams of finasteride is practically non-existent, and I go over that in my optimal dosing of finasteride video, which I'll link below. I've seen many other rodent studies that look at finasteride side effects or effects on neurosteroids that supposedly support the concept of post-finasteride syndrome, but they end up using the equivalent of hundreds of milligrams of finasteride per day, which isn't very realistic. These finasteride benefits in this particular rat study use doses much closer to the realistic human doses, which makes me think that these beneficial cardiac effects are real, unlike post-finasteride syndrome, which is just a fake QAnon conspiracy theory. All of this research was further confirmed by a study done in 2015 by Zwadlow. This study looked at the subtypes of the 5-AR enzyme in the heart. The 5-AR enzyme has 3 subtypes, also known as isoenzymes. They are numbered 1, 2, and 3. The type 2 subtype is the most prevalent in the hair follicles and the prostate as well, while the type 1 subtype is prevalent in the sebaceous glands of the skin. I haven't talked much about the type 3 subtype in my videos because it isn't known to play any role in hair loss, and thus it often isn't discussed in hair loss research. We know finasteride predominantly blocks the type 2 and type 3 isoenzymes, while dutasteride is a strong blocker of all 3 isoenzymes. But it is the type 2 enzyme suppression which is why these drugs work to stop hair loss as well as shrink the prostate. Well, interestingly enough, even though the type 3 5-AR isoenzyme is usually overlooked in hair loss research, this particular study by Zwadlow showed that in both mouse and human hearts, it is in fact fact the type 3 isoenzyme that is the most prevalent. What makes this very important when it comes to heart disease research, though, is that there are some types of heart disease which are characterized by thickened heart muscles, such as hypertrophic cardiomyopathy and heart disease from high blood pressure or heart disease from blocked heart valves. In these types of heart disease, all three types of the 5-AR isoenzyme are markedly increased in the heart. You may think this is just a correlation and not a causation, but you'd be wrong on that front, because in this study, finasteride treatment was found to improve all parameters of cardiac function in mice with artificially induced cardiac hypertrophy. Finasteride even improved survival in these mice, as seen in this figure, and also with flutamide, which is an androgen receptor blocker, this also had the same beneficial effects as finasteride. Also, elevated DHT levels were found in the heart cells from the mice with cardiac hypertrophy, suggesting that DHT is in fact the main problem. Surprisingly, this was also true in female mice, so heart disease can elevate the 5-AR enzyme levels and DHT levels even in females, proving once again that DHT is a trash hormone, not just because it kills your hair, but also because it kills your heart as well. Looking even further into the role the 5-AR enzyme in DHT play in heart disease, there was a similar study performed on mice that was published in 2018, but this time the investigators looked at the effects of finasteride on heart attacks in mice. Once again, the type 3 5-AR isoenzyme was found to be elevated in mice after a heart attack. DHT was found to be elevated in the heart cells as well. Given these facts, it's no surprise that finasteride markedly improved heart function after heart attacks in mice. Here's some of the evidence presented in this study. This figure here shows the increase in the mRNA for the type 3 isoenzyme after MI, which stands for myocardial infarction, which is a heart attack. This figure here shows the drop in ejection fraction, which is a measure of how well the heart is pumping with the MI, and how finasteride partially reverses this drop in ejection fraction. The investigators also found that finasteride even promotes angiogenesis, which is the formation of new blood vessels, and thus helped with the healing of the heart attack area. So the study authors concluded, quote, "In conclusion, we demonstrated a beneficial role of anti-androgenic treatment with finasteride in post-MI remodeling of mice. As finasteride is already approved for the treatment of benign prostate disease, it could potentially be evaluated as a therapeutic strategy for heart failure after MI," unquote. So it turns out there is a lot of animal data showing finasteride is useful in heart disease, and that this is because the trash hormone DHT worsens heart muscle damage, and it's probably because of DHT that men have more problems with heart disease compared to women, and why women generally live longer than men. I'll go ahead and show one more figure though from a study of castrated rats published in 2019. In this graph, the higher the bar, the more heart tissue damage there was in these rats. The first bar on the left shows the tissue damage from a heart attack without any intervention. The second bar shows the effect of testosterone infusion, and like we saw in a previous study, testosterone in castrated rats reduced tissue damage. However, the third bar shows that adding finasteride and blocking the conversion of testosterone into DHT markedly limits the tissue damage. The fourth bar shows the combination of testosterone with 40HA, which is an aromatase blocker, and thus prevents the conversion of testosterone into estrogen. Estrogen clearly is beneficial, and the lack of estrogen worsens the amount of heart damage. Finally, the last bar blocks both the 5-AR enzyme and the aromatase enzymes, so all that is left is unconverted testosterone, which has the same effect as seen in the control group bar. This graph shows really well that the reason men have a rough time with heart disease is not due to the testosterone in the body, but rather due to DHT, and women do better than men, both because of having lower levels of DHT and having more estrogen. So you may be asking yourself right now, but Kevin, these are just rodent studies. Don't you have anything that suggests this applies to humans as well? Well, as it turns out, I do, because in 2019, Catty published a study looking at finasteride in patients with chronic heart failure. This study was from the same group that did the previous two mouse studies on finasteride and the heart. This was a retrospective study of 1,041 patients with heart failure and prostate enlargement who were either on an alpha blocker drug named tamsulosin or finasteride for their prostate enlargement. The patients on finasteride were matched to similar patients who were instead on the alpha blocker drug. It was found that the wall thickness of the heart, meaning the hypertrophy of the heart, was lower in the group on finasteride than the group on the alpha blocking drug, suggesting that finasteride really does decrease cardiac hypertrophy in humans. Another study published in 2021 by Lusty is worth bringing up though. This is a a retrospective database study, including 175,201 men with benign prostatic hypertrophy who were on either no treatment, a 5-AR inhibitor, either finasteride or dutasteride, or an alpha-blocking drug, or a combination of these two types of drugs. The study looked at the incidence of heart failure over time, and the investigators found that the risk of developing heart failure for men on a 5-AR blocker was 1.09 times the risk if they weren't on any prostate drug. Alpha-blocking drugs increased the risk by 1.22 times. If you look at this figure, the red line, which represents subjects on 5-AR drugs, and the brown line, which represents subjects on 5-AR drugs and alpha blockers combined, and you can see actually for the first 6 years of follow-up, they have a lower incidence of heart failure than the blue line, which represents subjects on no medication, and the green line, which represents subjects on alpha blockers alone. So if anything, there appears to be a protective effect in the first 6 years, but after 6 years, the lines cross, and being on no medication appears to be better than being on a 5-AR blocker. So I would say that this study, though, it's really inconclusive about the risk of 5-AR blockers, and we need better research as far as the role of 5-AR blockers in causing heart failure. And fortunately, we do have a much better study and a much bigger study, and this one comes from Good Korea, and it was published in 2019, and it includes 215,003 Korean men who were treated with 5-AR blockers, either finasteride at 5 milligrams per day or dutasteride at 0.5 milligrams per day for prostatic hypertrophy between the years 2004 and 2010. This study fortunately found no risk of increased heart disease with the use of 5-AR blockers, so that's great. But even better news is that the study found that the subjects who took 5-AR blockers for the longest period of time actually had a decrease in their risk of cardiovascular disease, including a decreased risk of heart attack and stroke. So to summarize all this massive data, there is strong evidence that DHT is a trash hormone for the heart. It's one of the reasons men drop dead more frequently than women. But the good news is that 5-AR blockers like finasteride can reverse these bad effects of DHT and decrease heart muscle hypertrophy, as well as limit the size of heart attacks, at least in animal models. Human studies so far are less impressive, maybe because lower doses are taken by humans than those that are given in mouse studies. But the main problem with the human studies so far is that it doesn't appear that well-designed studies have been done in specific patient populations yet, like people who have just had a heart attack, for instance, or people who have had a diagnosis of heart failure or cardiac hypertrophy. We need randomized trials in these patients, but I wouldn't be surprised, based on the animal data, if future randomized controlled trials show that finasteride might not only save your hair, but also save your heart as well. Heart disease is the biggest killer of the human organism on the planet. Even something like COVID, which is now the third leading cause of death in the world, absolutely pales in comparison to the number of people killed by heart disease. The majority of people who are watching this video, in fact, will die because of heart disease. That's how prevalent it is. It is clear, based on the existing evidence, that DHT shortens the lifespan of men due to the damage DHT does to the heart muscle, and that it is very possible that in the future, finasteride will be used routinely to help mitigate this damage due to its ability to lower DHT. It is hard for many people to fathom how something that occurs naturally in our body can cause a potentially life-threatening problem, but the fact of the matter is that the human organism is not perfect, and neither is evolution. If it were, there wouldn't be any men suffering under the slaphead curse to begin with. The fact that we continue to even produce DHT is likely just an evolutionary accident, but it is one we fortunately do not have to suffer any longer thanks to the existence of finasteride. And when you take your finasteride, you can do so knowing that it not only is preserving your hair, but it might also be reducing the bad effects of DHT in your heart. More research needs to be done, but from what we know so far, it looks like reducing your cardiac DHT might be even more important than reducing the DHT in your hair follicles for overall longevity. It used to be that doctors would recommend patients take something like a daily aspirin as a means of preventing heart disease, but due to the fact that aspirin can potentially cause stomach bleeding, that is no longer recommended. So it is possible finasteride may be a safe alternative for those who are looking for a daily drug to help mitigate the risk of a heart attack. So there's a finasteride side effect for you there. It could save your life. Maybe a finasteride a day doesn't just keep the hair transplant doctor away, maybe it also keeps the cardiologist away. But at the very least, people who use finasteride can use it in confidence, knowing that it isn't just protecting their hair, but it may very well be reducing their chances of dying from a heart attack. And I think that is just another great reason to use it, and probably why I will continue to use finasteride, even if the upcoming Kintor hair loss drugs like piralutamide and GT2 0.20029 end up being better than finasteride. And with that, thank you for watching, chooms. I'll see you next time. Take care.